Hello, Dr. Terrie. It's such a pleasure speaking with you today. I'd like to begin our discussion with talking about the mom-baby connection. What can you tell us about this special time?
So thank you, Sheridan. I have the privilege of being both a neonatologist, which is a baby doctor, and a child neurologist. So my research has focused a lot around trying to understand brain development in the newborn and the lifelong implications of it. What we've discovered in our research and others have discovered is that this time during pregnancy and during these first few weeks and months of life are really critical for lifelong, not just brain development, but I can also talk about other impacts. So what do I mean by that? And you asked particularly what the connection is between a mother and their either fetus or newborn infant. And it's remarkable biology. You know, the human body is designed to have this intimate relationship between a fetus and a newborn and their mother. And it does it in multiple ways, which includes signaling by hormones, signaling by other types of mechanisms, such as inflammatory or immune markers, and signaling by the types of nutritional signals that might be going across into the baby. So that from the mother through the placenta, and the placenta is an intimate partner in this too, into the baby, there is the capacity for each to talk to each other about how they are doing. So if a mother is really feeling, you know, good, is getting a good nutrition, is not suffering from a lot of negative stresses, is not having any active infections, is not exposed to any active toxins like drugs or cigarette smoke, alcohol, any of those negative things, then these things all help send a nurturing, positive signal to that newborn in utero and allow the newborn to optimize and develop their body and brain in the best possible way. And some of these constructs around the signaling into the baby have been sort of termed almost programming. That's one of the technical terms we use, where the fetus which is forming is very vulnerable to the impact of these signals, and it indeed pre-programs the way the organs are formed and then the way those organs remain for the rest of your adult life.
Wow. So what happens in that 9 months in the room is basically your health destiny. Do you have more insights on that?
Yeah,